Hello everyone, I hope everybody is preparing very well for the upcoming Fmge exam July 6th. Today we are going to quickly revise all the IEL topics from anatomy, and these are the points we are going to discuss, the hot topics of anatomy. Let's get started. Yeah, now let's discuss the skull bones. What is the encircle part here? This is called as what? Pterion. Yes, it is located between the parietal, frontal, sphenoid and the temporal bone. There is a very important structure passing through pterion. What is it, sir? It is called as, yes, middle meningeal artery. Very good. Next, look at the point here. What is this? This is called as bregma. This has been asked several times in the exams. Please do remember bregma. Now, what is the structure here, sir? This is called as what? Coronal suture, a C-shaped one called as coronal suture, and this is going to be sagittal suture, and this is going to be our lambdoid suture. Very good. Next, moving ahead with the carpal bones. It comes with the famous mnemonic. I think everybody knows this. Let's quickly revise. She looks too pretty. Try to catch her. Yes, what is she? S for scaphoid, L is for lunate, T is for triquetral, P for pisiform. This is trapezium, trapezoid, catch, C for capitate, and M is for hamate. Remember, the most commonly fractured carpal bone is going to be what? Scaphoid. Very good. And most commonly dislocated bone is going to be lunate. Great. Next. Now, let's revise the tarsal bones. Tarsal bones. How do we remember, sir? It's very easy. You're going to remember with the mnemonic 3 C's TN. Let's see. What are the 3 C's? First is going to be what? The calcaneus. Next, we have the cuboid, and then we have the cuneiform. Yes. Cuneiform has, remember, it has got the medial cuneiform, intermediate cuneiform, and the lateral cuneiform. Very good. Now, with this, we have completed the important bone structures. Moving ahead into cranial foramens. Let's start with the easiest one. This is very easy. What is this foramen called as, sir? This is called as foramen magnum. Very good. Just close to it is going to be the hypoglossal canal. There is a J-shaped foramen. What is this J-shaped? This is going to be jugular foramen. Very good. This is called as what? Jugular foramen. Now, what are the nerves passing through jugular foramen? Please remember, it is going to be cranial nerve 9th, 10th, and the 11th. Very important. Yes. Now, we see 3 more foramens which is coming in the mnemonic ROS. ROS. You heard it right. R for Mr. That is going to be MR. Let's remember like this. It's very easy. Foramen rotundum. It is going to be what? Maxillary nerve. That is going to be what? Maxillary nerve. Next, O, foramen ovale, comes with the mnemonic male. M-A-L-E, male. What is M for, sir? M is for mandibular nerve. Mandibular nerve. Next, A is for accessory meningeal artery. Next, L is for lesser petrosal nerve. Lesser petrosal nerve. And then E is for what? Emissary vein. E is for emissary vein. Great. Now, just next to this, we have one more foramen called as what? Foramen lacerum. That is called as what? Foramen lacerum. Please do remember it. What is the structure passing through it? It is going to be internal carotid artery. Very good. Let's try to quickly revise. What is the structure here? This is called as foramen magnum. Right next to is going to be the hypoglossal canal. The J-shaped canal. What is this called as? It's called as jugular foramen. And then we have ROS, R-O-S, which is going to be foramen rotundum, foramen ovale, and foramen spinosum. Right next to it is going to be what? The foramen lacerum. Very good. Now, types of joints, they are classified into structural and functional ones. Structural ones are going to be very important. They are going to be fibrous, cartilaginous, and the synovial joints. Remember, Fibrous joints are going to be what? They are immovable. They are immovable. They are going to be sutures, syndesmosis, and gomphosis. Let's revise. Suture, syndesmosis, and gomphosis. The cartilaginous joints are going to be partially movable. They are going to be partially movable. They are synchondrosis and symphysis. Next, we have the synovial joints, which are the gliding hinge, and then we have the ball and socket joints. Let's revise with the image. The first one is going to be what? Between the C1 and C2, it is called as what? Pivot joint. P, primary, C1 and C2. Good. Between the elbow, what is it called as? Hinge joint. Hinge, E for elbow. Very good. Next, we have the saddle joint. It is between the trapezium and the first metacarpal. Saddle joint. Next, we have the ball and socket joint. Our favorite one, it is going to be between the hip joints. Very good. Next, we have the condyloid joint between the radius and the carpal bones of the wrist. And then we have the plane joint, which is between the tarsal bones. Good. Joints are going to be very important for the exam as well. Keep revising. Another important topic is going to be anatomical snuff box, commonly asked in the exam. Remember, what is the content? First point, remember, it is going to be radial artery. Very good. Next, you are going to remember the medial and the lateral borders. Medial border, remember the mnemonic MEPL. MEPL. Yes. What is medial border? It is going to be the extensor pollicis longus. Very good. Extensor pollicis longus. Lateral border, they are going to be extensor pollicis brevis and abductor pollicis longus. Very good. So this is going to be our medial border, and this is going to be what? Our lateral border. Content is going to be the radial artery. Very good. What is the image here, sir? It's very easy. That is going to be due to what? Radial nerve, and this is called as a wrist drop. Vertebral artery, remember V, vertebral artery. Let's keep your hand like this so that you don't forget. V is for vertebral artery. Next, we have the basilar artery, and then we have the posterior cerebral artery. Next, we have the posterior communicating artery, and then we have the internal carotid artery, and then along with that we have the middle, and above is going to be the anterior cerebral artery, and then at last is going to be the anterior communicating artery. Let's revise with the image. Now, V, what is this? So this is going to be vertebral artery. Next, we are going to see basilar artery, and then we have what? Posterior cerebral artery. Next is going to be our posterior communicating artery. Here we have the middle meningeal artery. Here we have the internal carotid artery, and then above is going to be what? The anterior cerebral artery, and this is going to be what? Anterior communicating artery. Please remember circle of Willis. Great. Let's look into the neural tube defects. What is the first image here? This is called as what? Craniorachisis. Please look at the image. And the second one is going to be anencephaly. Great. Now, types of spina bifida. When there is tuft of hair, it is called as what? Spina bifida occulta. When there is accumulation of spinal fluid, it is called as what? Meningocele. When there is going to be involvement of the spinal nerves, it is called as myelomeningocele. Yeah. Now, moving ahead with the histology part, stratified squamous epithelium is classified into keratinized and non-keratinized. Remember, in keratinized, the cells are going to be flattening in the top layers. Yes, as we can see, the cells are becoming flattening along the top layers. Keratinized stratified squamous epithelium is classically seen in the skins, whereas here in non-keratinized there is no flattening. Non-keratinized is classically seen where? In esophagus and in vagina. Now look at this image here. This is the image of transitional epithelium. The nucleus is not flattening. The nucleus are not flattening at the top layers as well. Yes, and these are called as what? These are called as umbrella cells. Very good. And this is the image of what? Ciliated pseudostratified columnar epithelium, and they have what? Flagellas on the top layer. Very easy to remember. Yeah. Next, nerve supply of the ear. Let's try to quickly revise the nerves of the ear. we shall divide the ears into the upper half and the lower half. Yes, let's divide them. We'll divide them into the upper and the lower half. Remember, easy, the lower half is supplied by greater auricular nerve. Greater auricular nerve. Now, let's divide the upper part into medial and lateral. Medially, it is supplied by auriculotemporal, and laterally, it is supplied by lesser occipital nerve. Very easy. Now, remember, the medial part is anteriorly it is supplied by auriculotemporal, and posteriorly it is supplied by the auricular branch of the vagus nerve. Very good. Let's look into the nerve supply of the external auditory canal. The anterior wall and the roof is supplied by what? Auriculotemporal nerve, and the posterior wall is supplied by vagus nerve. Posterior wall and the floor is supplied by the vagus nerve. Good. Lumbar puncture, it could be either done in lying position or sitting position. Most important point you're going to remember is lumbar puncture is usually done where? L3. L3, please do remember. Next, let's try to revise the abdominal regions. There are going to be 9 quadrants. Let's revise one by one quickly. What is this? This is going to be the umbilical region. This is called as what? Umbilical region. Just above is going to be the stomach, which is going to be the region of epigastric, and down below we have the hypogastrium. Towards the left and the right side we have the hypochondrium. Right hypochondrium and the left hypochondrium. Here is going to be the right lumbar and the left lumbar, and here we have the right iliac region and the left iliac region. Now, what do I have to remember, sir? For the main exam, you are going to remember the 2 planes. This is called as what? The trabecular plane, and this is going to be the subcostal plane. Very good. Key point is that trabecular plane lies at the level of L5. Very good. It lies at the level of L5, and subcostal plane lies at the level of L3. Please do remember. What are these 2 lines, sir? These are going to be called as what? Mid-clavicular planes. Mid-clavicular planes. Yeah. Let's quickly revise the embryological development of the diaphragm. Remember, the septum transversum is going to be converting into what? Central tendon. The pleuroperitoneal membrane is going to be the muscular part. The peripheral margin is going to become the peripheric muscular part, and then we have the dorsal esophageal mesentery, which is going to be the crura of the diaphragm. Yes, there are 3 important structures which we are going to remember for the main exam. They are going to be coming with the mnemonic VOA. Very good. Now, vena cava lies at the level of what? T8. Esophagus lies at the level of T10, and the aorta lies at the level of T12. Very important. Remember, at the aortic opening, there is going to be what? Aorta passing through thoracic duct and the azygous vein. These are important points to be remembered. Next, let's revise the abdominal layers. So, when I incise the skin, you're going to go into what? Superficial fascia of the fatty layer, which is called as Camper's fascia. Remember, Camper's fascia. If you cut little deeper, you're going to go into the membranous layer, which is called as what? Scarpa's fascia. Remember, Camper's fascia and Scarpa's fascia. Very good. Now, looking into the muscles. Now, what is this muscle here, sir? This is called as what? External oblique muscle. Very good. And the muscle here, these are going to be what? These are the internal oblique muscles. And then we have the transverse abdominis muscle, and here this region, these are called as what? Transversalis fascia. These are the abdominal layers. Done. Next, what is the structure here, sir? This is called as what? Amphilocyl, and this is going to be gastrochysis. Now, amphilocyl, very easy to remember. It comes with the amniotic covering. Yes, amniotic membrane covering. Good. Let's try to quickly revise inguinal hernia. We have indirect and direct hernia. Indirect hernia comes with the mnemonic DIR. D is for what? Direct inguinal ring. Indirect comes with the mnemonic DIR. DIR. Direct inguinal hernia, it passes via the anterior abdominal wall and Esselbach's. Let's look into the Esselbach's triangle. We have to remember the lateral border, medial border, and the inferior or the base. Now remember, the lateral border is supplied by inferior epigastric artery, whereas the medial border is supplied by rectus abdominis muscle, and then inferior, the base is via the inguinal ligament. Very important to remember. Next, celiac trunk is another very important topic. Let's revise calmly. Celiac trunk, first point is going to be, remember, it lies at the level of what? T12. Celiac trunk, T12. Very good. Now look at the celiac trunk is further dividing into three branches. First is going to be the common hepatic artery. Second, this one is going to be what? Left gastric artery. And then it's going to be also splenic artery. Let's revise the three branches. First is going to be what? The common hepatic artery. First is going to be common hepatic. Here we have the left gastric, and then we also have what? Splenic artery. Now, what else do we have to remember, sir? Please remember, the common hepatic artery is further dividing into what? Proper hepatic artery. It is dividing into gastroduodenal artery and then also into gastric artery. These are the branch of common hepatic artery. Good. Now, also we have to remember, just below the celiac trunk is going to be our superior mesenteric artery. What do you have to remember, sir? It lies at the level of L1. Superior mesenteric artery lies at the level of L1. Inferior mesenteric artery, remember, lies at the level of L3. Remember, L3. Let's try to quickly revise the celiac trunk. Assume this is going to be our celiac trunk. There are going to be three branches. First is going to be what? The hepatic, common hepatic artery. Next, we have the left gastric artery, and then we have the splenic artery. Let's quickly revise celiac trunk, common hepatic artery. We have the left gastric artery, and we have the splenic artery. Now, the common hepatic artery further divides into three branches, which are going to be what? Proper hepatic artery, right gastric artery, and then we have the gastroduodenal artery. That's it. Let's try to quickly revise the very important nerves, which are going to be median nerve and the ulnar nerve. Look at the image here. What is this? This is going to be the median nerve. Very good. It is also called as what? Laborer's nerve. A thumb deformity is due to which nerve? Please comment your answers. Very good. Ulnar nerve. Remember, ulnar nerve is also called as musician nerve. In Guyana canals, ulnar nerve passes through it. Now, this is going to be our ulnar nerve. What is the injury to ulnar nerve called as? Please comment your answers. Good. Look at the beautiful eye here, but you're going to concentrate on what? The lacrimal sac and the lacrimal gland. Remember, the lacrimal gland is going to be located towards the lateral wall, and the sac is going to be located between the medial wall. Yes, the nose. Remember, the nose upper part is made up of what? 1/3 is made up of bones, and lower 2/3 is by cartilages. Yes. Next, let's try to look into the important muscles. Now, what is this muscle here, sir? This is going to be supraspinatus. Very good. And down below is going to be what? Infraspinatus. Good. What else do we have to remember? Remember, supraspinatus as 0 to 15 degree abduction. Now, deltoid muscles. Question to you guys. What is the nerve passing through deltoid muscle? It is going to be, please remember, it is going to be axillary nerve. Very good. It is going to be axillary nerve, and it gives 15 to 90 degree abduction. Very good. Now, what is this, sir? This is going to be called as what? Syndesmosis. It is going to be between the middle tibiofibular joint and middle radio-ulnar joint. Good. Look at the humerus bone here. The nerve which is supplying here at the surgical neck of humerus is going to be what? Axillary nerve. It is going to be axillary nerve. Along the radial groove, which nerve is going to be, sir? This is going to be called as what? Radial nerve. This is going to be radial nerve. And at the medial epicondyle, is going to be what? The ulnar nerve. Very good. Ulnar nerve. Great. Now let's look into the brachial artery. Remember, this is going to be our brachial artery. If there is pulseless sensation in the arm, it could be what? It is due to brachial artery injury. Now remember, along the cubital fossa, it further divides into what? ulnar artery and the radial artery. Very good. Now remember, in the cubital fossa, it comes with the mnemonic called as what? MBBS. Yes. M is for what? Median nerve. Contents of cubital fossa. M is for medial nerve. Median nerve. Good. And B is for what? Brachial artery. Brachial artery. It is going to be the ulnar artery and the radial artery. Another B is going to be biceps brachii tendon. Biceps brachii tendon. And then we have S is for superficial branch of the radial nerve. Superficial branch of radial nerve. Very good. Please remember cubital fossa contents. Next, now what is this artery here, sir? This is going to be what? Popliteal artery. Remember, it further gets divided into the posterior tibial artery and fibular artery. Yes. When someone palpates at this region, what is it, sir? It is called as posterior tibial artery palpation. Good. Now let's continue. This is going to be what? This is going to be called as genioglossus. Yes, this is the largest muscle of the tongue. It is also the safety muscle of the tongue, and it especially prevents the tongue from falling back. Yes. Now look at this image. What is this, sir? This is going to be Bostalac hernia. It is going to be at the back of the diaphragm. If it is in front of the diaphragm, it is called as what? Morgagni hernia. Good. Now, what is this? This is going to be congenital diaphragmatic hernia. It is due to the absence of what? Pleuroperitoneal membrane. CDH is due to absence of pleuroperitoneal membrane. Good. Next, look at the image here. This is going to be what? Cleft lip. Yes. We can see the abnormal fusion of what? Maxillary and the medial nasal process. It is seen in where? Trisomy 13, which is going to be Patau syndrome. Yes. Look at the image here. This is going to be what? Bell's palsy. It is a lower motor neuron palsy lesion. It is going to be involvement of what? Ipsilateral, same side paralysis. Now remember, it includes the forehead muscles and also facial nerve. Let's try to quickly revise the important structures of our brain. Let's go. What is this structure here, sir? This is called as what? Medulla. Very good. This is going to be what? Pons. Super. And just above is going to be what? Midbrain. Very good. Remember MPM. This is going to be midbrain. Here is going to be pons. Next we have the medulla. Great. This is going to be our brain stem. Super. Next, what is this, sir? This is going to be cerebrum. Yeah, and the C-shaped one, this is going to be corpus callosum. Let's repeat, this is going to be corpus callosum. And down here, this is going to be the ventricles, and we can also see what? This structure which is called as cerebrum. Let's try to identify it in where? In the radiological images. Now this structure over here, what is this called as? Medulla. This is going to be what? Pons. We know the mnemonic MPM. This is going to be the midbrain. Super. The C-shaped one, what is this called as? Corpus callosum. This structure over here, LKG question, that is going to be cerebrum. Very good. Now here are going to be the ventricles, and here we have what? The pituitary gland. Next, this is going to be what? This is going to be cerebellum. There we go. Next, look at here. This is going to be the Wolffian duct and the Mullerian ducts. Remember, the Wolffian duct forms the male genitalia. Very good. Wolffian ducts, wolf, forms the male genitalia, and the Mullerian duct, it forms the female genitalia. Mullerian. Yes. Remember, U for uterus, female genitalia. Next, look at the image here, sir. This is going to be what? The blue one. Look at the blue one here. This is going to be our Wolffian duct, and look at the red one. These are going to be the Mullerian ducts. Now remember, the blue one, the Wolffian duct, forms the male gonads. As we all know, it forms what? The testis, vas deferens, and the seminal vesicles. Very good. The red duct, which is going to be the Mullerian duct, this forms the ovary, uterus, and also what? The upper part of the vagina. Super. Let's quickly revise. Wolffian duct forms the male genitalia. It is also called as mesonephric duct. And remember, the remnant of Wolffian duct in females, it is called as what? Gartner's duct. Very good. Next, Mullerian, remember these forms the female genitalia. It is also called as what? Paramesonephric duct. It forms the fallopian tube, uterus, and also the upper part of the vagina. Yeah. Let's try to quickly revise the pelvic injury. Any hit to the perineum can cause membranous urethra rupture. At least remember, urine extravasates into the deep perineal pouch. Next, let's conclude the session with one-liners which have been commonly asked in anatomy in the exam. First is going to be CABG nerve of leg hampered is going to be what? Saphenous nerve. Saphenous nerve. Post-surgical submandibular swelling is due to what? Which nerve hampered? Lingual nerve. Yes. Ligament holding the spleen and not moving downwards. That is going to be what? Phrenocholic ligament. Cells involved in multiple sclerosis are going to be oligodendrocytes. Yes. Last, most common type of hernia in male and female is going to be indirect inguinal hernia. Indirect inguinal hernia. Yes. Relation of hernial sac with spermatocord. I repeat, relation of hernial sac with the spermatocord indirect is going to be anterolateral, whereas direct is going to be posterior to spermatocord. Yeah. So with this, we concluded our. Wish you guys all the best for the upcoming FMG and NEET PG exams. Stay motivated. You are all going to do wonders in the exam. Stay tuned for the upcoming videos of the other subjects. And until the next video, keep revising and study well. Thank you.